Dear viewers, welcome to this fireside chat on transforming India's healthcare through digitization, scope, challenges, and way forward for healthcare ecosystem. The Government of India introduced the flagship Digital India program with a vision to transform the country into a digitally empowered society and knowledge economy. The ongoing COVID-19 pandemic has highlighted the importance of expanding healthcare infrastructure and fostering the culture of innovation and technology development to re-evaluate and reimagine India's healthcare system. Ladies and gentlemen, I'm joined by eminent leaders. Please join me in welcoming Dr. RS Sharma, Chief Executive Officer, National Health Authority, Government of India, and Mr. Ritesh Talapatra, Managing Director, Optum Global Advantage, India. Let me begin the discussion. COVID has woken the world up towards the importance of an efficient, effective healthcare system. CoWIN, which is India's indigenous digital platform and tech backbone of COVID vaccination program, is set to go global. The world's fastest growing vaccine platform has joined India's victory in building made in India digital platforms, Aadhaar and UPI. Dr. Sharma, any initial thoughts on our gaps and your plans to strengthen access to quality healthcare?
Well, thank you, Arpit, for having me on this conclave. And it's always a pleasure to sort of join with Economic Times. Whatever events they do, I always make it a point to join there if I'm invited. And you have been very gracious in inviting me in many of your events. On the CoWIN platform, I must say that we have done pretty well. When the Prime Minister launched the program on 16th of January, at that time we had started with something very rudimentary. And soon we had to kind of ensure that this platform becomes scalable. This platform is able to take the kind of load which is expected to come. And ultimately, and most importantly, the platform has got to be citizen-centric. So essentially, it must serve a purpose for the citizens. It must not only serve as a data collection point for the government, but also it must provide certain flexibilities for a citizen. So for example, if a citizen has got dose 1 from a place X, he need not be confined to place X only for dose 2, because he might travel to place Y. And therefore, we must have that portability built into the form. You have to remind the citizen that you have had dose 1 at time T, and therefore your dose 2 becomes due on time T plus 28 days or 30 days or whatever is the recommended gap between two vaccines. That's one part. Thirdly, we also have to ensure that a person is able to get a certificate of vaccination, because that may be required for his travels, that may be required by his employer, and that may also serve as a reminder to him that if I have got first certificate, provisional certificate on this date, then the next date is due at that point. So I think these were some of the issues. And of course, from a public policy perspective, it is very important for us to learn as to what is the geographical reach of our vaccination program, how much is the population of a particular area, and how many people have been vaccinated, what is the breakup age-wise, gender-wise, and therefore we needed to have a real-time data on vaccination available. And I think with all these these things in mind, we architected this platform in that spirit. And that I'm happy to say that the platform has now become one of the largest platforms to have scaled up with these numbers. Now we have 480 million people who have been vaccinated using this platform. And we have the vacancies being published. It provides transparency in the sense that, imagine, some time back there was an issue of oxygen cylinders, in the second wave, and also remdesivir max, medicine. And look how much helter-skelter people were running, because there was no central and transparent system, so which basically could say as to where you will get the oxygen cylinders. Now, in a vaccine, suppose the same situation was there, people would have been just finding out, oh, kahan lag rahi hai vaccine, where is the vaccine, what kind of vaccine is this? It provides a transparency. It provides a very comfortable trust to the people that, look, we don't have any information asymmetry. Everybody has, I have the same information which a normal person has. So basically, everybody is looking at the same dashboard. Everybody is looking at the same vacancy list, and nobody is prioritized. Everybody who first come first serve basis. If there is a vacancy, you just get it booking done. So I think it has created, in a way, trust in digital platforms in a very short time, and people are now, using COVID and the partner parts applications. We also had a very clear idea of an open architecture. So we published what is called the APIs in the beginning itself, and later, as you know, there are hundreds of partners which are now actually booking appointments, which are bringing people, and they are using their platforms. ATM, Infosys, all kinds of platforms are now connecting with us. So as always, we have made a system which is interoperable, which is based on open standards, which is based on open APIs, and which is lastly based on open source. And that's what is the broad architectural principles of COVID, and I think it has done pretty well.
And credit goes to you, obviously, Dr. Sharma. I think country must thank you for creating such a great platform for the facility and creating ease of vaccination. Ritesh, United Health Group is a world leader in healthcare. You have seen many misses and best practices globally when it comes to healthcare. What are your overarching thoughts for the India?
I think we should prefer to look at Dr. Sharma for overarching thoughts on healthcare in India. There are many specificities about India, that he's fully aware of and adept at. Let me instead, look at spend some of the time looking at some of the more universal aspects of healthcare that at least we have seen. Some of what I would call the common elements across the globe, and obviously the first one of those would be the universal iron triangle. The strive towards lower cost, improved access, and improved outcomes, and achieving all three at the same time. And this is a universal challenge. For example, in the US, what we have seen is the cost of healthcare has been increasing higher than the inflation rate for many years now, to a point where affordability is actually a big concern. It automatically becomes a big concern. But there are good reasons for that. First of all, there have been lots of discoveries of newer medicines, a lot of newer procedures and protocols, which means people have started living much longer lives, sometimes even with chronic conditions. This is great, actually, but obviously it comes at a higher cost to society. And then, what do we do about it? What we do about it is we develop solutions to sharpen our analytical tools for more risk-based practices. We look towards more whole person care instead of specific symptomatic care. And finally, I think the administrative costs of healthcare can be fairly large. And there are commonly available tools, robotics, AI tools, etc., which we have used to make entire hospitals go completely paperless, automate a lot of manual processes, even some of the critical decision making. So that's the cost angle. Next is the access. How do people living in remote parts of the country access healthcare? And this is again a universal problem. For example, in COVID, we saw a large uptake in the utilization of teleconsulting. But obviously, over a longer period of time, we have to look at different things around safety, privacy, etc., and work that through. So that's the access part. And then there is the third part, which is the quality or the outcomes of modern technology. And obviously, using technology, we can look at standardizing care pathways, offering the next best action in real time, and in general, iron out all the possibilities for human errors. So this triangle, the cost, access, and outcome, this is a universal truth in healthcare. The other, I think, very sacred and universal truth is the relationship between a clinician and a patient. It's probably the most unique thing in healthcare. And whatever we do with technology, whatever we do, we should make sure that the clinician gets more time, more unrestricted time with the patient. And in that sense, technology should recede to the background and be unobtrusive there. At United Health Group and Optum, our mission is to realize a future where every person has access to high quality, affordable healthcare that meets their very unique needs and their very unique financial means.
Yes, very rightly said, Ritesh. As a country, we have plans to move from being data rich to data intelligent. Dr. Sharma, how can Indian healthcare sector leverage emerging technologies like artificial intelligence, machine learning to upgrade the healthcare ecosystem? What challenges do you see in achieving universal health coverage using technology, and what is the way forward?
Well, I agree with Ritesh that technology is not a primary stuff. Let's understand, technology is only an enabler. Technology makes things possible which are not possible otherwise. A, technology makes things much more ubiquitous, affordable, which may not be ubiquitous and affordable otherwise. So I think technology is an enabler. And technology, comes in various kinds of, ways. One is connectivity, another is, consultations, then deliveries. Specifically in health sector, you have, laboratory testings, consultations, delivery, and hospitalization, etc. And of course, surgeries and various other facets. Now, what is important is that we leverage this technology. See, one of the good things about us is there are one is that we in many sectors have begun on a clean slate. You see, those countries which have their legacy systems, they really make it feel very hard to change to the newer systems. We, unfortunately, and of course that has become fortunate now, that we are, beginning on relatively cleaner slates. We don't have the baggage of legacies. And therefore, we can leapfrog on many of these aspects. And some of the leapfrogging parts is, yesterday only, the Honorable Prime Minister launched what is called e-rupee, which is basically a person-specific and purpose-specific payment instrument. We have UPI today, which is actually doing 3 billion transactions per month. I mean, probably largest anywhere in the world, so to say, for a single system to do. We have digital identity, which actually is completely online and digital, and which plug into any domain for any service delivery domain. So, Aadhaar has become central to India's service delivery architecture. So these are very, very important things that we must realize. While we realize the limits of technology, we must also realize that we can do a lot of things using technology. So that's one part. I am not denying the fact that we have a lot to invest in the health infrastructure, because technology cannot, make doctors, technology cannot make hospitals. In some sense, it has to be physical. But we need to have those things are there, but we also need to leverage technology to increase the affordability, to increase the quality, and most importantly, to increase access. All these 3 points which Ritesh just now made. So I think that's very important. What we also feel that the newer breeds of technology, which is the artificial intelligence, machine learning, etc., they will also come into life once you have a digital, architecture, because it's digital only which can collect data, analyze, and as you know, all these AI and machine learning, they work very well when you have more data. So as you rightly said that we are data rich, but we also have to utilize this data, and therefore the second term which you used, Arpit, is data intelligent. So I think we need to do that, but for doing that, we probably need to create what is called a platform, where we will be able to bring all these things together, and we have to kind of glue all these things together. The connectivity, the software, services, the AI, precisely what National Digital Health Mission is seeking to do. As you know, we have issued consultation papers on a number of aspects, number of architectural pieces of National Digital Health Mission. One is the Unique Health ID. One is the Unified Health Interface. Another is the registry of the hospitals, labs. We also have this whole electronic medical records, personal health records. All these things are being built. And I think once you have this, which is interoperable, again built on the same principle of openness, of a standard openness, of the ubiquitous nature, anything can plug in API based, then I think we will have a beautiful play, and we will be able to fully leverage technology also utilize this data rich strength in actually doing the analysis, even diagnostics. As you know, today's tools of AI can do much better diagnostics, which better than a doctor. And I think that will become a great learning tool for our medical professionals as also one of the great assistants. So I think we must fully leverage technology, and we must do that with, of course, but we must also realize technology can do as much. Technology is merely an enable. Technology is merely a tool. It has to be judiciously used in the service of the people.
Dr. Sharma, the National Digital Health Mission has an objective of creating a health stack and a health ID, as you said. Please help us understand your plans on the health stack and health ID, and what role can the private sector play here?
I think that's a great question, Arpit, because people, people don't realize, and sometimes we are also very defensive in our kind of approach as to what we have done in this country. We may be a poor country, but I think we have done very many, real leapfrogging things in technology space. And I think this is always, from the internet onwards, you must have seen, it is a layered approach which actually works best. Nobody can make a single monolithic solution, end-to-end solution, because end-to-end solutions are largely silo solutions which don't work. So basically in this world, we need to create Lego type of components which can fit in and which can create, like a whole building can be created if you have the basic bricks, the basic building blocks. And that is the approach which we have taken in this country. And let me explain to you as to why we feel that India is in a very good position to build such a health stack, as you call it, or the architectural digital health mission. So one is that we have created certain digital public goods which are horizontal in nature, which means which can be used by any sector. So for example, the digital identity which I spoke about essentially is solving the who are you problem. Wherever you go, you are first encountered the question, prove that you are who you claim to be. And if you can prove that in a digital manner, that is the most efficient way of actually releasing the domain from doing that job of proving who you are. So for example, yesterday when you used to go to open a bank account, the bank fellow will first ask your identity document, first satisfy that I am RS Sharma, and then he will give me customer acquisition form to fill and do that. Now what is happening? Aadhaar has become a third-party trusted authenticator of identities, which means the bank fellow is now relieved of that responsibility. And therefore, it is now possible to open a bank account sitting at home because you can do electronic KYC using Aadhaar and open a bank account. And many banks are doing that, 811. I have seen many banks which are doing that. Now, it is not possible even in countries like USA to open a bank account sitting at home and completely digital manner, because there is no such system in USA where you can digitally authenticate yourself. So this is one thing which we made. Now on top of that, we have made a number of products which are loosely described as India Stack. So for example, we have made electronic KYC, where your digitally signed document, the identity document goes and gets deposited in the, let's say, bank's database or telecom company's database, and you can get a connection, mobile connection, you can get many services. Similarly, you have e-sign, a facility which India has created, where you can digitally sign a document without using a dongle, because your identity is online, therefore your authenticate, the key pair which is used for digital signatures can be delivered after you prove your identity online. And that actually enables you, do a operation in digital signature rather than a capex kind of operation where you need to have some kind of document. Similarly, digital payments, which you can do remotely. And today you can pay even as small an amount as 1 rupee to you without deducting even a single naya paisa. Now, this is again something which is also required in any transaction, any digital transaction you do, you probably will have to pay, and you can't pay it in cash. You have to have a digital payment system, which is there in India at a scale. So this part. Lastly, in today's world of data privacy and data security, one of the important part is consent of that person. I must give my consent to you to use my data. That is the new normal. Now, that being the case, how do you give your consent? You can't give your consent signing a piece of paper saying that I hereby give you my consent. Now, India has created what is called consent artifact, digital consent artifact, which is actually a digital token, which is verifiable and which says that here is the data which I ask Arpit Gupta to use for this purpose, for this time, and this is how the consent is given. Now that consent is a digital token which is verifiable, which can say, yes, this is a consent given by Mr. RS Sharma because my identity is verified. So you have, and similarly, day before yesterday, the Honorable PM launched e-rupee, which is basically I can give money to you for a specific purpose, and that is completely traceable. So what I'm saying is we have created these artifacts, these public goods, which can be used by both public sector and private sector. And this is what makes these building blocks for any platform of any sector, because any sector is going to use these things. Then, of course, there will be sector specific, artifacts, sector specific public goods. Like, for example, in health, you will have to have the registry of hospitals. You will have the registry of health, registry of health professionals, registry of hospitals. These are many laboratories. These are many registries you will have. You will have to have the electronic medical records, horizontal way of fetching the personal health records of a person. All these things will have to be built, and which will be using the underlying common horizontal digital public goods, which I spoke about just now. So this actually makes a very beautiful layered approach. And on that, top of that, you create what is called, basically health interface, which means you create a gateway and on applications, which means, this becomes a completely interoperable architectures. Today, if you have to book a taxi, either you use an Ola application or an Uber application. Tomorrow, when you have this kind of system, there you can use any application and can underlying book any hospital using any, which may be using a different application altogether. So the applications will be able to talk to each other through standard APIs. That is the vision of the National Digital Health Mission, which we have, and we are trying to kind of build that whole thing. And once it is built, I think it will also pave the way for building other platforms like digital commerce platform. We have now the Ministry of Ministry of Commerce is now creating what is called Open Network for Digital Commerce, ONDC. And that whole idea is basically how do you create a non-discretionary. You are not Amazonifying the process. Please understand. We are not creating some kind of monolith Amazon type of thing for health platform. No, sir. We are creating an open, interoperable, non-discretionary, non-biased algorithms and platforms, which will actually provide level playing field for any player, small or large. That's the broad concept of National Digital Health Mission.
Very well explained, Dr. Sharma. Let me take a small input from Ritesh also. Ritesh, your company is processing a vast amount of healthcare data. Any thoughts on the data protection policy?
The first thing I'd like to say is any player in the healthcare sector, us included, is fully aware of the need for privacy and protection laws. We understand it. Healthcare information is probably the most sensitive information. It's a very deeply personal information, so we get it absolutely. And secondly, as you can imagine, we have to respect the laws of all the countries that we operate in, and we respect that. I think in general, if I talk about my very personal reading of the data protection framework as it exists today, I think two observations. First, I think Dr. Sharma himself talked so eloquently about interoperability of information. I think that's the critical word. The data has to be interoperable. It has to flow through different systems so that the right decisions can be made by the doctor, for example. When he's making a decision on which course of action for a particular patient, access to previous medical records, previous histories, previous allergies are so important, right? So that interoperability of information that Dr. Sharma talked about, and he so eloquently talked about the different layers that enable it, is critical. So we think that's the right way to go, and that's what everybody in the world is striving for, and that's absolutely correct. But obviously, then that brings the question of if you what is the security and privacy of that information? And I think the only point there is that when a country sets up its own privacy and protection laws, that's completely correct. But then we are hoping that the different laws of countries are interoperable amongst themselves, if you will, right? They should not be in conflict with each other. For example, in case of the Indian bill, proposed bill, if there is a simple, there's clarity that the bill applies to Indian citizens, and similar to the Philippines Data Protection Act of 2012, if there's a simple exclusion that says this, if data is collected on another country's citizen in a different place, then we really don't care about it. Such a simple exclusion would make everything much clearer, because right now, that's one confusion area where I would say exists. To give an example, as part of the IT services and BPM industry, we process personal data from many different countries, including the US. And those countries have their own very stringent laws, like HIPAA, for example, and so on. And we are just hoping that there is a way that these laws of different countries can be compatible with each other.
Very, very well said, Ritesh. Coming close to the end of the conversation, my last question to you, Dr. Sharma, is citizens are keenly watching the efforts of states in delivering healthcare. What is your advice to state governments on state digital healthcare platforms? Will they integrate with your efforts, and are there any efforts towards standardized processes across states?
Well, Arpit, I think that's a very important question. As far as health is concerned, and it's a state subject. So the states are fully entitled and empowered to provide healthcare facilities to their citizens. But let's also understand that health, while it's a state subject, there's a lot of portability which happens. So, for example, in Delhi, a lot of people from all other states come. There are specialized hospitals in Mumbai and other places. So it is not as if it may be a state subject per se, but then there are consultations which are happening, which do happen among various this thing, and they don't really get into state boundaries. And it's desirable also. So after all, somebody sitting in Gumla in Jharkhand, and if he wants to consult a doctor in Mumbai, he should be able to do that. So essentially, and technology today allows that. So idea is that it's not a question of each person building a digital solution. We have absolutely no problem. What we are trying to do is that these digital solutions must talk to each other. And I'm sure nobody is going to have any objection that, oh, I will not expose my digital solution to somebody else, because ultimately, let's understand. Let's take an example. In payment system, when UPI was introduced, UPI, as you know, is an interoperable specification of protocols. It's not a solution itself. It's not some kind of software which is providing a solution for banking. There are solutions built on top of UPI. So, for example, BHIM, as you know, is a solution built on top of UPI, which the Honorable Prime Minister launched in December of 2016. Now, that having been provided, initially many big players opposed that. They said, no, we don't want to become a part of that. We are already a market in ourselves. We are doing things ourselves. So that's the way they basically started. Many big banks and many other solution providers, I don't want to name, but that's the approach which they adopted. But once this started rolling out and everybody realized that it is actually a good solution, it's a win-win for everybody, nobody is going to lose, then these guys realized that it is better. Now they joined themselves. So it's a question that if some platform or some part is doing something good to everybody, I do not see any reason that just you want to, I'm not saying merge with national digital. Merger is not the issue. You can keep your identities. You can still be Paytm, you can still be Google Pay, you can still be, I'm not saying that everybody should become UPI and that's the end of the story. No brands, nothing. No, that's not the way it is. We are not uniformity. We are not bringing uniformity. There could be certain value-added services which each solution may have, which others may not have. And that's how the free market works. But what we are saying is, if you provide a glue to make all these solutions interoperable, and interoperability is extremely important. If you see the digital big companies which have become so big, and other companies have been completely wiped out. Do you remember something called Orkut? There was a social media platform called Orkut. Nobody remembers Orkut now. So now, every this is the winner takes all situation in all the IT things, and which are there because of non-interoperability. I can't take away my data from the Flipkart and take it to Amazon, and I can't order on Flipkart on a platform at Amazon. That's not happening. So basically, what is important is you create a solution. This is a pan-India solution. Other solutions can certainly plug into that solution. This solution can plug into those solutions. Those will work with this. That's the whole idea. And therefore, the words which are important are interoperability, open standards, so that people can open APIs. We, in fact, in India has a triad of policies. These 3 policies are policy on open API, policy on open standards, and policy on open source. These are the 3 policies which we have, and we have done that in 2014, which are available on the websites also of the Ministry of Electronics and IT. So I think we are working on that part. We are saying that open source is only a policy for the government-related platform. So whatever we build, you will be surprised to know that the entire Aadhaar is built on an open source stack, except the biometric deduplication solution, which actually we don't have any software available which is scalable in open source domain. We had to get it from private companies. But the rest of the stuff, whether it's an operating system or databases or any other things, they are all open source products. So that's the broad philosophy, because we think that total cost of ownership goes down if you have an open source. But for us, it's not an ideology. For us, it's a pragmatic decision, and everybody has to make that pragmatic decision. So I think coexistence of various solutions is something which is assured. Nobody is going to take away somebody else's turf. So the basic constitutional duties will continue to be performed. Technology is not going to subsume everything into it. That much is certain. We are very clear on that approach. And I think the states are all on board. We have had consultations with these states, and everybody realizes that, if you have a platform which can, deliver good things, we must become a part of it.
Thank you, Dr. Sharma. Before we wrap up, let me just quickly ask Ritesh in just 1 minute. Optum Technologies is a subsidiary of United Health Group. Optum is known for digital healthcare. What is your India story, and where do you see the big opportunity? Your concluding remarks. What are your thoughts in strengthening digital healthcare through the private sector?
Yeah, we established our presence in India in 2006, and we have since then we've continued to move up the value chain. What I'd like to point out is that we have 30,000, healthcare, technology, and operations professionals that support, almost 2,000 very targeted healthcare processes globally. We are the largest, technology team for Optum outside the US. In the end, I'd like to say that using our 30,000 strong healthcare focused talent pool in India, we really aspire to build solution and build the future of healthcare right here in India. So that's really the big opportunity, build the future of healthcare sitting here in India. That's how we see our future.
Thank you, Ritesh. With this, I conclude this fireside chat. On behalf of PT government, I sincerely thank our special guest, Dr. RS Sharma, CEO, National Health Authority, and industry leader, Ritesh Talapatra, MD, Optum Global Advantage India, for sharing their knowledge and thoughts with PT government as part of the second edition of DigiTech Conclave 2021. Thank you so much.
Thank you very much, Arpit.